My name is Abby Smith, and today I'll be discussing dynamic video endoscopy use in performance horses, which is an article I found by E. Van Ark. Performance horses are considered the top athletes in their fields. They are intensely trained and conditioned with accuracy and have become the subjects of many studies on how their bodies work under competition conditions. Racehorses are commonly used for these studies, as they are highly regarded animals as well as athletes in the horse industry. Their nutrition, physiology, respiratory systems, cardiovascular systems, and many more are very finely tuned so they can race at their best. In a study conducted on 129 horses by E. Van Ark between January of 2010 and February of 2011, the goal was to find out if head flexion and equitation have an effect on the obstruction of the upper airway in performance horses due to the observation of many signs of airway inflammation. This presentation will discuss specifically the respiratory system of racehorses as well as non-racing performance horses and how upper airway obstruction, or UAO, can be detrimental to their value as a competitor and athlete. The study conducted on 129 horses of varying gender, age, and discipline. A summary of the horses used in this study can be found in the table on this slide. An interesting thing to note is that 9 of the horses used in this study had already had a surgery called laryngoplasty and were still making noise during exercise trials. Table 1 on this slide shows the horses used in the study, including their gender, disciplines, and ages. Looking at the table, we can see that 53 stallions were used, 34 geldings, and 42 mares, for a total of 129 horses. As far as disciplines, there were 59 dressage horses used, 63 show jumping, 5 driving, and 2 3-day eventing horses, for a total of 129 horses. The extension of Table 1 shown on this slide shows the respiratory problems that the horses in the study were referred to a veterinarian for, breathing problems, and reduced performance. Looking at the table, you can see that 41 were referred for poor performance, 70 for respiratory noise, 5 for a cough, 2 for epistaxis, 1 for head shaking, and 10 were referred for no problems at all and were used as the control group, again for a total of 129 horses from ages 2 to 20 years old. These horses were tested using a dynamic respiratory scope, or DNS, that was fastened to the bridle and a specially made saddle pad. The recording end of the scope was run through one of the nostrils of the horse until researchers could see the areas of concern in the nasal cavities. The timing in which the scopes were used started before exercise began and was stopped during the horse's recovery phase. During the testing trials using the DNS, horses were ridden by their normal rider and asked to do a normal training session for each specific horse, meaning the training sessions were different for each discipline, and were done until the horse's referral symptoms arose. To see if other variables made a difference, horses were ridden both outside and inside, with side reins, with free head movement, and with head flexion. Differences among horses were noted in the study and evaluated afterwards. During both rest and exercise, horses were given a certain score that corresponded with a respiratory problem. The table on this slide shows what respiratory problems these scores were for, and observation of other respiratory problems. Looking at the table, you can see that pharyngeal lymphoid hyperplasia was given a score of 1 to 4 based on severity, as well as a laryngeal score at rest, which was also given a severity score of 1 to 4. Arytenoid cartilage collapse was given a letter score of B or C. Pharyngeal instability, dorsal displacement of the soft palate, vocal cord collapse, and axial deviation of aryepiglottic folds were all observed characteristics and were just noted for their observation. All 129 horses used in the study were tested, and the following results were found from the tests regarding UAO. Test results did show that UAO was shown to be more prevalent in horses that were under intense exercise and had rider intervention to maintain flexion at the poll. The presence of UAO was more intense for dressage horses than show jumping horses. Dressage horses also had a higher incidence of dorsal displacement of the soft palate, arytenoid cartilage collapse, and vocal cord collapse. Arytenoid cartilage collapse and vocal cord collapse are both types of laryngeal collapse which can be detrimental to a horse's welfare and performance. The following chart shows a more precise results of the study done showing the respiratory problem, the number of horses affected, and the percentage of the horses affected. Looking at the chart, dynamic UAO is a generalized term used for multiple respiratory problems. So, looking at the first line, horses were referred for many kinds of respiratory problems, and 106 out of 129 were affected for an 82% effective rate. Horses that were referred for respiratory noise were 64 out of 70 for 91% of the horses affected. Those that were referred for poor performance were a total of 71% of the horses, or 29 out of 41. Those that were referred for routine evaluation, 50% were affected with some sort of respiratory problem. Those that were not found to have any respiratory problem were referred for a respiratory problem, and 23 of the 129 were shown to have a respiratory problem, or 18% of them. Those that found conditions other than respiratory problems that were referred for respiratory problems had a total of 14%, or 18 of 129 horses. The results from these tests showed that dynamic UAO is common in many performance horses and should be evaluated and monitored before horses are purchased for rigorous activities and put into intense training for a certain discipline. Other studies have been conducted related to this issue and have shown that there are many horses that suffer from dynamic UAO, and it affects their performance in their respective events. One study done by the University of Pennsylvania tested 100 non-racing horses using a high-speed treadmill combined with endoscopic aids to show that horses with respiratory noise and poor performance should be tested for dynamic UAO so they can be treated accordingly. Another study done by 3 veterinary colleges in Switzerland and the United Kingdom tested 100 racehorses that were referred for respiratory noise or poor performance. The horses in the European study were tested using dynamic respiratory endoscopy, which resulted in a variety of respiratory conditions that would affect their performance. In conclusion, horses that were referred to a clinic for respiratory noise or poor performance should undergo testing for dynamic UAO, which could include a variety of respiratory conditions, before they are put into intense exercise training for their respective events. The presence of a respiratory problem could be corrected with surgery or other methods depending on the severity of the problem. Other respiratory problems will require constant monitoring for the remainder of the horse's life, with medication, special living conditions, and light exercise. All in all, horses suffering from respiratory problems should be checked for dynamic UAO and treated accordingly. The sources I used for my presentation and paper are listed on this slide and include 3 different studies using video endoscopic evaluation of both racing and non-racing performance horses, all published in 2011 in the Equine Veterinary Journal. This slide also lists all of my photo references used in this presentation.